What if I told you that a simple blood test could predict with startling accuracy whether you will age gracefully or fall apart in the next decade? Most people go to their doctor, get standard blood work, and hear the words, "Everything looks normal." But here's the problem. Normal ranges are based on a sick population. Normal in America means you are aging at the same catastrophic rate as everyone else. Longevity scientists do not care about normal. They track 5 specific biomarkers that reveal your true biological age, your rate of cellular decay, and your risk of developing every major age-related disease. These are the markers that doctors at cutting-edge longevity clinics like Peter Attia's practice and the Buck Institute for Research on Aging consider the most predictive of how long and how well you will live. And the best part? Every single one of these markers can be dramatically improved with the right interventions. Let me show you exactly what to test and what your numbers should be. Chapter 1. HbA1c, the blood sugar time machine. Hemoglobin A1c is not just a diabetes test. It is arguably the single most important predictor of how fast you are aging. This marker measures your average blood sugar over the past 90 days by looking at how much glucose has attached to your red blood cells. An elevated blood sugar is the silent accelerator behind nearly every age-related disease. A study from the European Heart Journal that followed over 19,000 people found that for every 1% increase in HbA1c above 5.0, the risk of death from all causes increased by 28%. That is a massive number for a single percentage point. Here is why blood sugar drives aging so powerfully. When glucose levels stay elevated, it triggers a process called glycation, where sugar molecules bond to proteins throughout your body and create advanced glycation end products. These molecules literally stiffen your blood vessels, damage your kidneys, destroy collagen in your skin, and accelerate neurodegeneration. Glycation is essentially your body rusting from the inside out. The standard medical range for HbA1c considers anything below 5.7% as normal. But longevity physicians set the optimal target much lower, between 4.8 and 5.2%. In this range, glycation damage is minimized, insulin sensitivity is preserved, and your metabolic machinery runs at peak efficiency. A study from Johns Hopkins found that people maintaining HbA1c below 5.0 had the lowest risk of cardiovascular disease and cognitive decline over a 20-year follow-up period. To optimize your HbA1c, the protocol is clear. Minimize refined carbohydrates and added sugars. Walk for 15 minutes after every meal, which research shows reduces glucose spikes by up to 40%. Prioritize protein and fiber at the start of each meal to slow glucose absorption. And consider continuous glucose monitoring for 2 weeks to understand exactly how your body responds to different foods. Chapter 2. High-sensitivity C-reactive protein, the inflammation alarm. If aging had a master switch, it would be chronic inflammation. Scientists have coined the term inflammaging to describe how low-grade persistent inflammation drives virtually every disease of aging, including heart disease, cancer, Alzheimer's, and autoimmune disorders. High-sensitivity CRP measures this systemic inflammation with extraordinary precision. A landmark study in the New England Journal of Medicine followed over 28,000 women and found that hs-CRP was the strongest predictor of future cardiovascular events, even stronger than LDL cholesterol. Women with the highest hs-CRP levels had a 4.4 times higher risk of a heart attack or stroke compared to those with the lowest levels. But the implications go far beyond heart disease. Researchers at UCLA found that elevated CRP is associated with accelerated brain aging and increased risk of dementia. A study in the journal Cancer found that chronic inflammation measured by CRP was linked to significantly higher cancer risk across multiple organ systems. The standard medical reference range considers CRP below 3 mg per liter as normal. Longevity physicians aim for below 0.5 mg per liter and ideally below 0.3. At these ultra-low levels, your inflammatory burden is minimal and your cells can focus energy on repair and regeneration rather than fighting chronic damage. To drive hs-CRP down, anti-inflammatory nutrition is essential. Omega-3 fatty acids from fish reduce CRP by up to 30% in clinical trials. Eliminating seed oils and ultra-processed foods removes a major inflammatory trigger. Regular exercise lowers CRP by 20 to 30%. Sleep optimization reduces inflammation markers across the board. And maintaining a healthy body composition is critical because visceral fat is essentially an inflammation factory that pumps out inflammatory cytokines 24 hours a day. Chapter 3. Apolipoprotein B, the real cholesterol number your doctor probably ignores. For decades, medicine has focused on LDL cholesterol as the primary marker for heart disease risk. But longevity scientists now consider ApoB a far superior predictor, and most standard blood panels do not even include it. Apolipoprotein B is the protein that sits on the surface of every atherogenic lipoprotein particle, meaning every particle capable of driving plaque into your artery walls. Unlike LDL cholesterol, which measures the cholesterol content inside particles, ApoB counts the actual number of dangerous particles in your bloodstream. A massive study in The Lancet analyzing data from over 650,000 participants found that ApoB was significantly more predictive of cardiovascular events than LDL cholesterol, non-HDL cholesterol, or any other lipid measure. The researchers concluded that ApoB should replace LDL as the primary target for cardiovascular risk assessment. Here is why this matters for aging. Cardiovascular disease remains the #1 killer worldwide, and the atherosclerotic process begins decades before symptoms appear. By the time you have a heart attack or stroke, the damage has been building for 20 to 30 years. ApoB allows you to detect and address this risk in your 30s and 40s rather than waiting for a catastrophic event in your 60s. The optimal ApoB level according to leading longevity physicians is below 80 milligrams per deciliter for most adults, and below 60 for those at higher risk. The Mendelian randomization studies are clear. Lifetime exposure to lower ApoB levels translates directly to lower cardiovascular risk. Every 10 mg per deciliter reduction in ApoB is associated with a roughly 15% reduction in major cardiovascular events. To optimize ApoB, dietary changes can help, but are often insufficient alone. Reducing saturated fat, increasing soluble fiber, and maintaining a healthy weight are the first steps. Many longevity physicians also consider early use of lipid-lowering therapies given the overwhelming evidence that lifetime ApoB reduction is the single most impactful intervention for preventing cardiovascular death. Get this marker tested and discuss your optimal range with your doctor. Chapter 4. Vitamin D, the hormone masquerading as a vitamin. Despite its name, vitamin D is not actually a vitamin. It is a steroid hormone that your body produces when sunlight hits your skin, and it influences over 1,000 genes involved in everything from immune function to bone density to cancer prevention. And an estimated 42% of American adults are deficient. A meta-analysis published in the BMJ that included over 73,000 participants found that vitamin D supplementation reduced overall mortality by 11%. For cancer-specific mortality, the reduction was an astounding 16%. A study from the University of Copenhagen analyzed over 95,000 participants and found that those with the lowest vitamin D levels had a 35% higher risk of death from any cause and a 57% higher risk of death from cardiovascular disease. The connections to aging are extensive. Vitamin D activates over 2,000 genes and is critical for immune regulation, reducing the chronic immune dysfunction that drives inflammation. It maintains bone density, preventing the fractures that dramatically reduce quality of life and increase mortality in older adults. It supports muscle function, reducing fall risk. And emerging research shows it protects telomere length directly. The standard medical threshold for vitamin D deficiency is 30 nanograms per milliliter. Longevity physicians target between 50 and 70 nanograms per milliliter, a range associated with the lowest all-cause mortality in observational studies. A study from the Grassroots Health Research Institute found that women maintaining vitamin D levels above 40 nanograms per milliliter had a 67% lower risk of all-invasive cancers. To optimize vitamin D, get your blood levels tested first. If you are below 50, supplementation is almost certainly necessary. Most people need between 4,000 and 8,000 IU daily to reach optimal levels, though individual needs vary dramatically. Vitamin D is fat-soluble, so take it with a meal containing fat, and test again after 3 months to verify you have reached your target range. Chapter 5. DHEA sulfate, the aging clock your doctor never checks. Dehydroepiandrosterone sulfate is the most abundant steroid hormone in your body and one of the most reliable biomarkers of biological aging. DHEA-S levels peak in your mid-20s and then decline steadily, dropping roughly 2 to 3% per year. By age 70, most people have only 10 to 20% of the DHEA-S they had at 25. This decline correlates almost perfectly with the aging process, which is why researchers call it the aging clock hormone. A 25-year longitudinal study published in the Journal of the American Geriatric Society found that men with the lowest DHEA-S levels had a 370% higher mortality rate compared to those with the highest levels. In women, the lowest levels were associated with a 250% increase in death risk. DHEA-S is not just a passive marker. It actively supports immune function, maintains bone density, preserves lean muscle mass, supports cognitive function, and serves as a precursor to both testosterone and estrogen. When DHEA-S drops, multiple body systems deteriorate simultaneously because they are losing a critical hormonal building block. The optimal range for DHEA-S varies by age and sex, but longevity physicians generally aim to maintain levels in the upper quartile for your age group, or even in the range typical of someone 10 to 15 years younger. For men, this generally means above 350 micrograms per deciliter. For women, above 200. Several lifestyle factors can help maintain DHEA-S levels. Regular exercise, particularly resistance training, has been shown to boost DHEA-S production. Adequate sleep is essential as DHEA-S is produced primarily during deep sleep. Chronic stress directly suppresses DHEA-S because your adrenal glands shift production toward cortisol at the expense of DHEA. And maintaining a healthy body weight helps preserve hormonal balance. Some longevity physicians also recommend low-dose DHEA supplementation for older adults with documented deficiency, though this should only be done under medical supervision with regular monitoring. Those are the 5 blood markers that longevity scientists consider the most predictive of how long and how well you will live. HbA1c for metabolic health, hs-CRP for inflammation, ApoB for cardiovascular risk, vitamin D for immune and hormonal function, and DHEA-S as your biological aging clock. Here is what I want you to do. At your next doctor's appointment, ask specifically for these 5 tests. Print out this list if you need to. Most of these are inexpensive and covered by standard insurance. When you get your results, do not just accept normal. Compare them to the optimal longevity ranges I shared today. The gap between normal and optimal could be the difference between aging gracefully and declining rapidly. If this video changed how you think about your health, subscribe to Longevity Lab because every week we turn cutting-edge longevity science into actionable protocols you can use today. Drop a comment with your biggest takeaway from this video. Knowledge is only power when you act on it. I will see you in the next one.